hospital to hospitals. We also drive the HR7, which is the messaging standards that is in there. Then there is the law for the labs. You have the basically the DICOM for the RIS, which is easy. So you need to create interoperability in that sense. Okay, there are also an easy way to do that. Singapore actually have done the EMR exchange, where you can have different kind of format, okay, and you are able to access the documents, okay, to do that. That's one way that they do, but they are moving away from that, is to really, the government need to mandate, just as Sanjita had mentioned 2 days ago, on the first day of this event. You need to mandate, okay, the standards. So the government is going to put in that, and Malaysia do the same thing, right? IHE is the standard. If you want to respond to my RFP, you need to actually make sure that you are IHE, okay, certified in the Connectathon, okay? And you also have to have HR7, okay, in terms of which version, okay, that you are going to. I think this is very important. My experience is that technology is always the easiest part. Okay, the difficult part is really that you need to bring in all the stakeholders. You need to bring in the regulators. You need to bring in the service provider. You need to bring in the vendors, okay, that comes in and agree, okay, how things are going to move forward. Okay, or else we can talk about technology, but you're not going to solve the key fundamental healthcare issue, which is the quality, which is the cost, and which is the accessibility.
Great. Thank you for that. I think with that, what we would like to do is kind of open it up for any questions that anybody may have. And can you let us know who the question is directed to, please?
This question is maybe for Ram Mohan. This is the HIPAA Act, which is there in US. Do you foresee a similar kind of an act for the insurance sector in India?
There is no specific for health which is there in India, but the IT Act 2000 and the recent one which has been changed last year has made very stringent penalties for deviation of any SLAs or using data. So I think that itself will cover quite a lot as far as the privacy is concerned. And breach of data also has been classified as a criminal offense in the last act. So I think that should cover, and I don't think there could be a regulation that could be coming in the health or the insurance companies joining together to make a regulation as well. Well, I'm not aware of that. Maybe Sanjay or Alam, if you can.
Anybody want to add?
Yeah, I just want to add one point that recently IRD is coming out with a customer service, and they want to have a contact center available where any consumer of any insurance company can go and register a complaint if there is any. Now, with IRDA getting into a mode of going back to the customer, understanding the pain, my gut feel is that there would be some regulations which will come up in the form of a standardization. Because one of the key pain areas which consumers would also come back and say is, I have different formats if I go to different hospitals. So that's what my gut feel is, although there's no regulation which is available right now.
For the question, I'm Dr. Sanjeev Sood. We share your views that surely the insurance sector, health insurance sector is poised for growth in our country. But at the same time, our perception is that it's also at the crossroads. The challenge it is currently facing is that it needs a close coordination between the patient, payer, and provider, of course. But the challenge it is facing is that the hospitalized patients face inflated bills. There are some fraudulent claims, and as well as there are high claim ratios. So the cracks of this understanding we already see appearing in the recent withdrawal of the cashless insurance happening here in our country. So to prevent that, either we move towards a managed healthcare, or in the present system we face these current challenges. So how do you see that we can resolve both the conflicts and maintain a proper balance between the both pathways and see how the future of the health insurance sector pans out in our country?
For that, we'll need a 2-day event, which will happen in Delhi on September 9th and 10th. Come visit us at the CII Health Summit, and maybe some of your questions get answered. That's too big a question for this forum. Thank you.
The technology is good enough for the back office operations, but most of us will also be concerned about these issues being addressed by the experts like you. Second question was from the consumer's point of view. We feel that a person who needs insurance, say after 30 years of age or 40 years of age, he will have some pre-existing illness. So if he discloses that illness, he is denied the insurance cover itself, even though he is willing to forego any claim on basis of that illness for next 4 years. Insurance companies don't touch him with a barge pole. And do you plan to cover those people who have some pre-existing illness, and also to provide products which will cover the preventive aspect of healthcare, say people who want to take membership of gymnasium so that they remain healthy, and you provide that kind of cover, or you also cover the nursing administered or delivered healthcare so that the cost of healthcare delivery come down?
Okay. I think I'll take this in 3 parts. The first part, when you said that a consumer is denied of an insurance, as far as I can just talk about Max Bupa right now, because that's the company which I represent today. Max Bupa, we do not deny an insurance to anybody for a PEA, which is a pre-existing ailments. There are exclusions which are included, and there are different kind of exclusions. Some are exclusions for 4 years, some are exclusions for 2 years. But the consumer is not denied for an insurance unless it is a really a worse scenario. The second is there's no age bar as far as a Max Bupa is concerned. Insurance is available to any age limit. Moving on to the second part, which you said that a consumer should get a feel that he or she is really being taken care. We have a concept of a relationship manager, and what we really say is if an individual, and these relationship managers are across India and specifically to the locations wherein we exist as a branch today. These relationship managers are closely linked to the network hospitals, and they take care of the individuals who is hospitalized. They closely work with the doctors in terms of what is being prescribed, is it right or is it wrong, because these are mere minimum MBBS doctors as a relationship manager. The third, which you spoke about, doing a preventive care, I think it's a concept which is very new in the Indian market, and for anybody to be able to do a preventive care, you need to have the base data. And that's what we are doing, is we are capturing the information of a consumer from the day when they join us. Because asking for a data which is before that, I don't know whether people would be able to provide the data, or if I have any kind of a repository which I can go and access it. But from the day a consumer joins us, we are planning to move into that forum wherein we can be a wellness health manager for that individual. I'm just coined a name just now, but we want to move into a preventive or a wellness kind of a programs. But before that, what I feel is that we need to have the data available from our consumers before we start doing those wellness programs. I don't know if that suffices.
My question to the panelists is, with so many networking and database solutions being established and implemented, is there any attempt to integrate all this? I heard about the UID scheme from the government, but is the government also doing with the partners from the private sector to do something about it?
Okay.
So I think the question is very valid. If you really ask me that, when you go out, I'll tell you from my experience, when we went out, started evaluating if there are any systems or if there are any technology even for a specific requirement. When I say specific requirement, means a specific process. Let's say just the enrollment or just the fulfillment or just the claim. If there are any packages or the softwares which are available in the market which could be evaluated. And I don't know whether you'll believe it or not, there was none which was there. So finally what happens is, because it's a growing segment, you want to satisfy a customer, you want to work as per the customer need, you end up developing the system, you end up enhancing the system because you need to provide an improved services. But any standardization across the private, I think this industry has to grow to an extent wherein people can talk about that standardization.